When a child dies under the care of a public institution, every minute before the death matters. But every decision made afterward matters just as much. Because after tragedy, families deserve answers. Healthcare professionals deserve the truth, and the public deserves confidence that the investigation was thorough. According to public accusations filed by the California Board of Registered Nursing, on June of this year, Jai Elizabeth Torres was the acting director of health services for Fresno Unified School District during the events that followed the death of an 11-year-old student in February 2022. Importantly, the board's accusations is not a final determination of wrongdoing. It is a formal allegation initiating disciplinary proceedings, and Ms. Torres has the right to contest those allegations before the board reaches any final decision. This episode examines what the board alleges and why those allegations matter to nurses, school districts, and families. The accusation begins with the underlying medical emergency. According to the board, on February 18, 2022, an 11-year-old student with asthma arrived at the school nurse's office in severe respiratory distress. The accusation states that before arriving, the student had already self-administered an albuterol inhaler approximately 6 times in the classroom. The school nurse documented increased work of breathing, noting that the child sat upright and hunched forward while trying to breathe. The nurse also documented that the child should be referred to a physician or emergency department. Yet, according to the board, emergency medical services were not called. The accusation further alleges that rescue medication was not administered and that the child was released to a family member who intended to take the student home. During the drive, the child suffered cardiac arrest, resulting in an anoxic brain injury and ultimately death. For many organizations, the incident itself becomes only the beginning. After a serious adverse event, especially the death of a child, leaders are expected to determine exactly what happened. Not approximately, not generally, exactly. The accusation alleges that Fresno Unified Executive Officer of Human Resources directed Ms. Torres to conduct that investigation. That assignment carried enormous responsibility. Because the quality of an investigation shapes future training, policy, accountability, and ultimately whether similar tragedies can be prevented. This is where the accusation changes focus. The board does not allege that Mrs. Torres provided direct clinical care to the student. Instead, it alleges deficiencies in how she investigated the incident afterward. According to the accusation, Mrs. Torres reported that she had completed an investigation and concluded that there had been no wrongdoing by the school nurse. The board then lists out several allegations showing the shortcomings of that investigation. First, the accusation alleges that no written investigative report was created. Second, it alleges that although informal discipline and coaching were reportedly provided, the investigation did not identify which actions warranted discipline or describe what coaching was actually given. Third, the board alleges that the investigation did not include a review of the student's medical records related to the incident. And finally, the accusation alleges that Mrs. Torres did not interview the student's family members or the medical providers who treated the child after leaving school. Taken together, these alleged omissions form the basis of the board's disciplinary case. Now step back. Forget names, forget districts, forget headlines. Imagine any hospital. Imagine any emergency room. Imagine any pediatric intensive care unit. If a child dies and the internal investigation never reviews the outside medical records, never interviews treating physicians, never speaks with the family, and produces no written report, would most healthcare professionals consider that investigation complete? The broader question is what gives this case significance beyond Fresno? The board's accusation frames these alleged failures not simply as administrative oversights, but as potential evidence of professional incompetence and unprofessional conduct under California's Nursing Practice Act. The accusations also points to California regulations defining nursing competence. Among the expectations listed are evaluating care, supervising others appropriately, applying the nursing process, and acting as the client's advocate when circumstances require. The board alleges that Mrs. Torres failed to meet those standards in her role overseeing the investigation. Whether those allegations are ultimately sustained will be determined through the disciplinary process. This case is much bigger than one nurse. It is bigger than one district. It raises questions that every healthcare system should ask after a catastrophic event. Was every document reviewed? Was every witness interviewed? Were difficult questions avoided, or were they answered? Did the investigation seek to understand what happened or simply conclude that nothing went wrong? The California Board of Registered Nursing has made its allegations. Mrs. Torres will have the opportunity to respond. And as this process unfolds, Nurse Watchdog will continue examining what these proceedings may mean for accountability, transparency, and the standards expected of nurses entrusted with leadership responsibilities. If you believe the public deserves evidence-based reporting on systemic healthcare issues, please subscribe to Nurse Watchdog, leave your thoughts in the comments, and follow this series as we continue reviewing the public record. Nurse Watchdog, signing up.